Thanks, Corinne. A quick follow-up on that. Obviously, consumers don't see the benefits until 2026. How concerned is the administration that Republicans could potentially derail the process by then and roll back these negotiations after the next election?
Well, I would say first and foremost, this Medicare's ability to negotiate drug prices is hugely popular. 80% of Americans support the ability to negotiate drug prices. I do think it's important to point out that many Republicans oppose the Inflation Reduction Act and obviously oppose the ability to negotiate drug prices. So they are on the side, they have been on the side of allowing pharmaceutical companies to charge whatever they can. And that's what the American people really oppose. As I've said at other times, I was part of the team that negotiated the Affordable Care Act. I was here I was arguing for the Affordable Care Act when Republicans were trying to repeal the Affordable Care Act during the Trump administration. They fought tooth and nail to do so, but because the Affordable Care Act had delivered lower prices, or basically delivered health care to 20 million Americans, they found it hard to do so. And I think given the insulin reduction, the $35 insulin costs that people are bearing now, the fact that that people will see that these 10 drugs are being negotiated, a price will be provided in September of 2024. That will be public. I think it will be hard to repeal the Inflation Reduction Act, and it's specifically hard to take away, basically claw back these benefits, these lower prices. I think people will really rise up against that kind of thing because they know they are paying too much for prescription drugs in the United States, and they are paying more than in any other country.
Go ahead, Selena. Welcome to the briefing. Thank you so much. The CBO estimates that the government will save around $98.5 billion over a decade with this new program. So how much of those savings will go directly to seniors on Medicare?
So that is savings. There is significant savings to the Medicare program. But seniors pay out-of-pocket costs for prescription drugs. In fact, the person who will be introducing the president pays significant out-of-pocket costs. So people who have out-of-pocket costs, this will deliver lower prices for them. We don't know what the negotiated price will be. This is a subject to negotiation, so we can't tell you the specific amount that people will save, but there will be savings to people both paying out-of-pocket and also to the Medicare program itself.
Thanks. Hey, Neera. There are currently 8 lawsuits challenging this Medicare drug negotiation program. Which of those lawsuits do you see as the biggest threat to this program, and how confident are you that between now and 2026, when all this kicks in, that one of these lawsuits won't result in an injunction or preventing this program from actually going forward?
Well, first and foremost, we should recognize that the CMS, HHS negotiates prices for every other element of the healthcare system: doctors' rates, providers' rates, hospital rates. The only reason why Medicare has not been negotiating drug prices is because pharma got a sweetheart deal decades ago to basically prohibit negotiations. Negotiations are part of the market system. It's very normal for that to happen. And so we are very, very confident. Basically, it is because of the Inflation Reduction Act that we have negotiations. We are very confident in the law, and we should recognize there is no part of the Constitution that prohibits Medicare drug negotiation. So we are very confident in these cases, and very confident that the law will deliver results. And just important to remember that basically what pharma is arguing in these court cases is that they should have no limit to be able to charge whatever they want. And that is exactly why Americans support the Medicare drug negotiation by 80%.
So you're not especially concerned by any of these lawsuits?
I mean, I refer to the Department of Justice on the particularities of each litigation or each piece of litigation, but I would say that first and foremost, Medicare's ability to negotiate drug prices is clear in the law and is well established.